Hello, everybody. Hope you all are doing well. Happy Monday. It's a brand new week. This is the Daily Money Live with Janae. I haven't been on here in a couple of days, but I wanted to come on here today mainly because the healthcare exchange has opened back up. Okay, the healthcare exchange has opened back up. So, those of you who are new to the Daily Money Live with Janae, what this is that I go live throughout the week with different money topics or money articles and go a little deeper into them so that you can win with your money. So that's why we are making sure to talk about the healthcare exchange that opened back up today. So I am on Instagram as well as on Clubhouse. So if you have any questions coming up, for those that are on Clubhouse, make sure to mute yourselves so we can't hear it in the background and everything. But this is what is going on. This has never happened before at all for them to open up the exchange. The healthcare exchange usually opens up towards the end of the year, and you have a certain amount of time, like usually in December is when it closes up. Okay, so I'm always one of those people in December that's rushing. It's like 2 weeks left and they just keep calling, keep emailing, like you need to renew your healthcare and so forth. Now the healthcare exchange is for people who cannot get their health care at work. They have a spouse, they can't get it through there, and so those are the ones who are able to go through the exchange. And of course they call it Obamacare. I'm calling the ACA, the Affordable Care Act, the healthcare exchange, but it came out under President Obama, and he just wanted to make sure that more Americans were insured with healthcare, because in my previous life, before I started my own business, I was in pharmaceutical sales for 10 years. Okay, so I was on that side of healthcare, and what many people don't tend to understand is that there is money savings in healthcare through preventive healthcare. All right. So if people are going to the dentist, okay, every 6 months or at least once a year, people are going to their annuals, getting their checkups and so forth, that actually lowers cost, because things can, if they have anything that's an issue, like the blood pressure starting to rise or the LDLs, which that has to do with cholesterol. I'm not going to get too deep in the woods. But LDL, HDL, triglycerides has to do with cholesterol and heart disease and all that kind of stuff. So if you can go and do your annuals each year, that kind of stuff can get caught early and taken care of before it gets out of control and you have to be on medication. Medication for things like heart disease, diabetes, high blood pressure, that is something that a lot of times if you get on it, you're going to be on it for the rest of your life. And that is a lot of money that comes out of your pocket for the rest of your life. And not only do you have the medications, depending on what disease it has, these are all those kind of metabolic syndrome kind of diseases. Depending on what you are dealing with, you can end up having 4 or 5 doctor visits a month, every week, every 2 weeks. So that's where the cost of healthcare rises. So when President Obama decided to do Obamacare, ACA and all that kind of stuff, it was about saving money within the healthcare system, because it was becoming unsustainable. Okay, it was becoming unsustainable. So having said that, that is what has been going on for over a decade now, the healthcare exchange. Now, I love it because I am an entrepreneur. So those of you who are entrepreneurs, the healthcare exchange, like before that came out, a lot of people, especially women, would not become entrepreneurs, especially if they had children, because they did not want to be in a position where they didn't have healthcare. And before Obamacare came out, guess what? That was the issue. You were not going to have health care. COBRA, for those of you who have worked in a job and you lose a job and you get COBRA is ridiculous. I think when I was laid off in 2008, found out I was $50,000 in debt. COBRA was $800 a month. I'm like, are you crazy? $800 a month for 2.5 people. My child was like a 1. And they wanted us to pay, we young, and they wanted us to pay $800. That's the kind of ripoff healthcare was before Obamacare came, right? So I'm thankful for it because I'm an entrepreneur, and because I was in healthcare for 10 years, even though it was the pharmaceutical side, although I was on pharmaceuticals, not only did I had to know about the medications, I had to know about health insurance and understanding each player in the health insurance field, and just understanding what the offers are. Okay. So if you are watching this or you're on Clubhouse and you're listening to this and you do not have health care right now, understand that the exchange opened back up today for, I believe, 3 months. And the reason President Biden has done this, first of all, because we're in a pandemic and people need to have health insurance. But for the last 4 years, the Trump administration has been pretty much trying to annihilate Obamacare. They took the money away from the promotion. They took the money away from marketing. They were trying to get as many people off of it as they possibly could so they can try to negate it and pretty much get the Supreme Court to get rid of it, which did not happen. And because of that, right now, it is 15 million people who are eligible for Obamacare that is not on it, okay? And so now they're doing this new push. They're going to put $50 million behind the marketing alone to get these 15 million people, as many as possible, to get signed up. Because the more people who have preventive health care, the less burden is going to be on our healthcare system. The less money that is going to have to be spent out by the government, by people out of their pockets, all that kind of stuff, because people are going to have preventive health care. So ladies on here, that's why it's important for make sure you go get your annual every year. Right now, because of Obamacare, our annuals are free. You know, that's not counting any extra tests and all that kind of stuff, but the basic annual is free. When you go get your annual as a man, children, they go get their yearly annuals and so forth, that is free, thanks to Obamacare. Okay, so it is open today. And so if you don't have health insurance right now, you need to go look at the exchange. They also are spending money on what they call healthcare navigators. And I believe healthcare navigators are people who are very skilled in helping you find a healthcare plan on the exchange. I don't know if they're free or not. I have never had to use one, but they are ramping them up to try to get more people signed up for healthcare. Now, I will give you a few tips when picking a plan, if you need to pick a plan off the exchange. And just not even giving you tips, I'm helping you understand it and you can make your own decision about it. Okay, I'm trying to help you understand as you make your own decision. So the plans that I get, because people are always asking me, you know, Janae, why you don't pay so much for your health insurance? It's because I have a very high deductible. Okay, I have a very high deductible, and so understand that when you're thinking about any kind of insurance, car insurance, health insurance, when you're thinking about deductibles and co-pays, the higher those things are, the less you pay a month. Okay, so with my health care for 4 people, I have a out-of-pocket deductible of $15,000, right, for a family. If you don't have that kind of money, okay, if you don't have that kind of money to come out of pocket, like if you have, that's like catastrophic. That's like something happens for real. And the hospital bill, you know, it's a major surgery, something like that, is $15,000. Like we have to spend out of pocket $15,000 before the health insurance kicks in. Okay, that's what I mean by high deductible. But because I have that high deductible, I have an extremely low monthly payment. Okay, the lower your deductible comes down. So let's say you need it to be at $10,000, $7,000, $5,000. The lower it comes, the higher your monthly payment is going to be. So that's why you hear people saying that their monthly payment, like I've heard people say $800. I'm like, what is your deductible? Like $20? Like why is it $800 a month? You know, so that's why it will go up if you have a lower deductible. Kick the deductible up, and like I said, that's with health insurance, that's with car insurance. You kick the deductible up, your payments come lower. I did the same thing when I was paying off the $50,000 of debt in the 2 years. I went and reevaluated my home insurance and my car insurance. And by doing that, I upped the deductibles. Like my deductible was like $250. No, we need to put that up to $500, $750 for the car, whatever it was. And then the house was like, I don't know, $2,500 or something. Yeah, it was $2,500 because I needed my monthly payments to come down. So here's a money tip. I needed my monthly payments to come down so I could have more money each month to put towards the debt. Okay. So that's something that people always ask me, well, how'd you pay the 50 grand off in 2 years so fast? I found the money. And that was one way that I found the money, was going to reevaluate my home insurance and my car insurance and getting that down. Okay. And then that, I think it gave us probably like an extra 100 a month. And I put that 100 towards the paying off the debt. Okay. So just understand, this is the strategy with health insurance. The higher the deductible you have and you can afford, the lower your monthly payments will be. All right. The lower your monthly payments will be. But if your deductible comes down, like you need that deductible to be that out of pocket deductible, that's what it's called. If you need that to come down, just know that as it comes down, your monthly payment will go up. Okay. So you have to see what you think you can afford if something happens. So something, I mean, I'm not going to even speak nothing on anybody. Just something happens that's catastrophic, that has you in the hospital, all that kind of stuff. Guess what? That's what the out-of-pocket deductible is. You got to reach that before they start chipping in whatever percentage they'll chip in. Okay. So I know we're on Clubhouse and we're on Instagram. So if anybody has questions on either one of them, so Clubhouse, you feel free to raise your hand, and then of course, on Instagram, you can just put your question in the question box. But this Daily Money Live with Janae was about that the healthcare exchange has opened back up, I believe, for the next couple of months. It has never done that. Like when you miss it in December, at that deadline, you always have to wait till it opens back up, which is usually like October, November. But they have opened it back up for the very first time ever in March. So if you need healthcare, if you need health insurance, you need to go ahead and go to, I think it's healthcare.gov. Remember, make sure it's .gov, okay? Because a lot of these fake accounts be out here trying to steal your information. I believe it is healthcare.gov. But it's the Affordable Care Act, Healthcare Exchange, Obamacare, all that kind of stuff. So make sure that you're signing up for the right thing. I think it's like blue and green. It's mostly blue. Got a little green in there is the website, just in case you feel like you're not in the right place. All right. And of course you can call them. They have some kind, I think an 866 number or something like that. And somebody will talk you through. They're very good with their customer service. They answer the phone with no problem. Like when it first came out, it was a lot of waiting time, but now they've got really good with answering the phone and getting back to you and that kind of stuff, and they can walk you through the website really easily. So if you need help with the site, make sure to give them a call, and they might even have a chat option. They might have a chat option on there too on the website. I don't know. They've been improving it each and every year, but I have been on the healthcare exchange for at least 7 years, maybe at least. So I have no problem with it. I like it. Like I said, I was in healthcare for 10 years, so I understand health insurance, and I understand what I need and what I don't need. So here's one thing. The plan that I have has dental for my children, so they get dental for free. It does not have it for me, right? So when I go to the dentist, I pay for out of pocket. They get my teeth cleaned, it's probably like $100. It's nothing, right? So I'd rather pay that $100 twice a year than what I think it was $27 a month for just the dental. No, that's way over $200 a year. So we're just going to pay for the cleaning. So you got to always look at all your options and do the numbers. So that's why I said, go ahead. If you need health insurance, go ahead and start it now. Don't wait like I do to the last minute and try to figure all these numbers out and do all that kind of stuff. Just go ahead and do it now. And if you can find you a healthcare navigator, get you one, and they can help you as well. All right. Any questions at all, whether it's on Instagram or Clubhouse? Any questions? Hope everybody's had a great start to your week. Promise, do you have a question?
No, I was literally just about to say, thank you for explaining this, because, I just moved back down to Florida, and my dad was like, look, you need to get on here and get your health insurance now. I was like, yeah, I haven't had it for, whenever.
Yeah.
And you explaining this makes me, oh, okay, I get it now. Now, yeah. So by the end of this month, I'm going to get on there and get it done. So
awesome.
I just wanted to thank you for this.
No problem at all. And thank you for joining in too. Yeah, so and I'm actually doing a private speaking engagement on Thursday and talking about closing the wealth gaps. And what I'm gonna talk to those the audience about is one of the things is healthcare. So we're gonna be talking about life after college and about money and healthcare, because that's one of the things that it's an expense that can bankrupt people. Okay, it is a major expense that can bankrupt people. That's why I always tell people to try to, as best as you can, to have health insurance, because that's outside of student loan debt and your house and all that kind of stuff. That is the one bill, these hospital bills, these doctor bills. When you have an emergency, you have to have, your appendix taken out, that kind of stuff. It bankrupts people, and all over this country. That's one of the things that I hear the most people reach out to me, like, how can I get out of this medical bill, this hospital bill? It's just so much money and I don't know what to do. So having health insurance, even if it's, some of these, and the 15 million people that are uninsured, they were talking about on the radio today. Like, I got this was an NPR episode, and they said the 15 million people that were uninsured right now, because of their income, more than likely will have free health care anyway. And a lot of people throughout this country don't even know that, because Trump for the last 4 years has pretty much just eliminated the marketing behind it. And nobody knows that they probably won't pay anything per month. And they're just out there being uninsured. But if they ever get sick and have to go to the hospital, the emergency room, just a visit to emergency room can have you, a couple of $1,000s. You get into that ambulance, is $800 just for the ride, because they are not attached to the hospital. Ambulance companies are private companies, okay? So they can charge you whatever they want and everything. So that's medical bills is one of the things that bankrupt people the most in this country. So it's very important for for anybody on here, especially the 15 million people that they were talking about, to make sure that they get health insurance some way, especially if you don't get it through your job. If you get it through your job, perfect. Because a lot of times jobs have really good health care. Not everybody, okay? but having just any kind of health care works, all right? So I thank you all. Any questions on Instagram at all before I cut everything off? All right, before I cut everything off, do you have any questions? Because I know you all are going to be in my DMs after this, but this is your time to ask your question so that anybody else who might have the same question can get the answer as well. All right? All right, going once, going twice. All right. Instagram, Clubhouse, I hope you both have a great evening, and I will be back on hopefully sometime this week as well to talk about another money topic or money article to help you win with your money. And if you're just joining me, make sure you watch the replay here on Instagram so that you can get the tips that I gave. All right, bye-bye.